thank you for joining me today for a level 1 Pilates mat class. We are going to be going over some foundational Pilates and just overall stability and strength movements, and then getting into some of the core foundational Pilates work here today. If at any point in time you feel any discomfort or pain, please stop moving and either reset your body or just sit in a resting position and wait until we go to the next move. I will try as best as I can to give as many modifications as I can as we go along, and I hope you enjoy. So we're going to go ahead and start standing today. Feet hip width apart, and I invite you to just close your eyes here. And with your eyes staying closed, see if you can just breathe in through your nose and out through your mouth. And notice just any kind of observations that you may or may not feel in your body. Inhale in through your nose and out through your mouth. See if you can feel your rib cage and your belly expand with that breath in. And if you feel everything kind of gently compress inward towards your center as you fully exhale. Do you notice tension in your shoulders, your neck, clenching in your glutes or your quads? And just try to relax through any of that which you may or may not be feeling. A few more breaths here. In through the nose, out through your mouth. One more breath in, and one more breath out. We're going to go right into some gentle knee bending here to prepare for a squat. So I want you to simply inhale as you bend your knees, and then exhale to stand. Inhale, bend. Exhale, stand, gently pressing down through those heels. Inhale. Exhale, straighten. Two more like this. Last one. And now if you have it available to you, let's go into a full squat. So inhale as you bend, arms reaching out to counterbalance that weight back. Exhale, press your hands down, stand up nice and tall, reaching through the crown of your head. Inhale to lower. Exhale, stand. Inhale down. Exhale it up. And notice where your weight is in your feet here. Do you feel like you go way forward onto the toes or really far back onto your heels? Ideally, it would feel very centered and balanced. So like your weight relatively stays right over top of your ankle, and that you're able to feel your big toes and your heels into whatever surface you're standing on. Let's do two more. Last one. Exhale to stand. Now we're going to come into a standing position again, but with our hands on our shoulders. Knees are soft here, so I'm not locking them out. I'm keeping this gentle bend. From here, pretend like you have headlights on your hips. So those headlights are facing straight ahead. They're not to swerve all over the road. So keeping that in mind, we're going to gently rotate through your spine and feel like your rib cage is directing this rotation. If the rib cage feels like it's the very thing that's moving, there's a good chance that you're using your abdominal muscles to rotate your back rather than twisting from your spine, which can feel very compressive. A few more like this. Continuing with your gentle breath. And finish the one that you're on. Stand up tall, hands stay on the shoulders. From here, we're going to take an inhale. As you lift your chest up and out, draw your shoulder blades and elbows down. Now exhale to curl through your back, pull your elbows forward, feel a little stretch between the shoulder blades. Inhale, lengthen up and out through your sternum, elbows drop down. Exhale as you round, elbows come in. Inhale, we gently extend through the spine, lift the chin. Exhale, curl through your back, elbows come forward. Few more. Inhale, lifting up tall. Exhale, rounding. Inhale, lift. Exhale to round. One more breath each. Inhale. Exhale out. And then coming back to a standing position and drop your arms. From here, let those arms be heavy. Hopefully you're starting to feel almost a little taller already. Take a deep breath in through your nose. And now as you exhale, drop your chin towards your chest. Start to gently roll down through your spine, letting your head and arms be heavy. Coming towards the bottom of the mat. Pause when you're at that position where you feel like you're getting a stretch, but it should not feel uncomfortable or painful. Take a deep breath into your bra line, or if you're a gentleman, into your mid-back. And now exhale as you slowly start to roll it up. Press through your heels. Come up one vertebrae at a time, all the way to standing, lifting tall through the chin and your chest. Inhale. Exhale to round it down. Let the crown of your head be heavy. Allow your knees to be soft so that weight stays over the ankles. Deep breath here. Fill the ribs with air. Exhale. Feel like you're driving your tailbone down. So you can come up one vertebrae at a time without overworking or straining that low back. Last one here. Inhale, growing tall. Exhale down. Rolling through your back. Now allow your knees to bend so your hands can touch the floor, and let's gently come down onto our hands and knees. We're going to continue with our little warm up here with some spinal mobility work. If for any reason you have wrist or knee issues that keep you from doing this position comfortably, you can choose to come down onto your elbows. You could put a pad or a towel under your knees. Otherwise, go ahead and follow along with me. Take a deep breath in through your nose. Now as you exhale, I want you to gently round your back by lifting your spine to the ceiling and bring your abdominals and your ribs up with you. From here, inhale to simply flatten your back. Don't overextend coming into that severely arched position. Just flatten. Exhale to round, lifting your abdominals and rib cage with you. Inhale to flatten and feel like you're pulling your shoulder blades back, reaching your sternum out. Exhale, round and lift. Tucking that tailbone. Inhale, lengthen out through the crown of your head and your tailbone. Nice straight line. Exhale, lift. Inhale to lengthen. One more time. Inhale and lengthen. From here, we're going to do a little belly breathing. So I'm going to try to pull my shirt up so you can hopefully see a little bit of what I'm getting at here. In this more flat back or neutral spine position, I want you to inhale and fill your belly up with air. Feel like it's dropping down towards the floor. Now exhale, pull your abdominals back up towards your spine. Inhale, belly relaxes. Exhale, abdominals and rib cage lift. A few more breaths here. If your wrists or your shoulders are getting tired, you can always come down onto your elbows. One more breath. Good. Come off of those hands for a second. You can kind of just open the palms up, reach your sternum out. You feel a little bit of a stretch in the front of your shoulders and arms. Whew. Kind of shake it out. And now one more time, let's come onto those hands and knees for what we call tail wag. So my hands are under my shoulders, my knees are under my hips. I'm going to gently round my back by lifting my ribs and abs. And then I'm going to take my right foot off of the mat. My knee is still attached, just the foot comes up for a little hamstring curl. Now, here's where the tail wagging part comes in. You're going to laterally flex, trying to look at your foot and rotating that foot out past your body. And now I'm going to rotate the other way. So my foot's going to the left now as I laterally flex and try to look at my foot to the left. And again, we tail wag to the right and we tail wag to the left. All the while, hopefully you're breathing and gently thinking about lifting those abdominals with each exhale. One more tail wag, right and left. Come back to center and lift the left foot. Same movement. So I am tail wagging to the left side. My foot's going out past my body. And now I bring my foot in towards my center and I look at it to the right. Rotating out to the left. And rotating in, laterally flexing my spine. One more each way. Exhale out. Place that foot down. Gently sit back into a child's pose. Reach those arms forward. And take a few breaths here. Noticing if you can feel your ribcage expanding, if you're able to let your belly go. And just be careful with sitting with your knees too wide. That actually can be very compressive for your sacroiliac joint, which is that region where your tailbone meets your hip bone. From here, we're going to make our way onto our backs. Laying down as gently as you can, in whatever way is most comfortable for you. We're going to keep our knees bent so our low back is soft. Hands are going to come onto our abdominals, right to the side portion where the ribs start to really come low. From here, you're going to take an inhale through your nose, tongue resting on the roof of your mouth. Now fully exhale that air out and notice how as you get that full exhale, your fingertips start to feel your abdominals tighten and engage. Inhale. Through your nose, exhale. And again, breathe in. Belly and chest expand. Now full exhale out. Make it last longer than that inhale so you can really feel those abs doing their job here. A few more breaths. When you exhale, feel like you're blowing out through a straw. So you're pursing your lips, you're pressing that air out. It's not a more ocean breath where it would just be it's a 2 more. Last breath. And pause. Good. From here, we're just going to do a little bit of pelvic work before we get into some abdominals. So I want you to pretend like you have a clock on your hips. 12 o'clock is towards your pubic bone, 6 o'clock is up towards your belly button, and then 9 and 3 o'clock are your 2 hip points that you're easily able to palpate on the side of your hips. So keeping those times or those numbers in mind in their positions, we're going to tip our hips forward towards that 12 o'clock position at the pubic bone. What that's doing is lifting and slightly arching me in my low back. Now, tip your clock to where you're going towards that 6 o'clock position or your belly button. Notice how your back has now flattened. Again, tip forward to 12 o'clock and tip to 6 o'clock, which is more of a tuck. 12 o'clock tips forward, 6 o'clock tucks back, low back's pushing down. Inhale as we go to 12. Exhale as you tuck to go to 6 o'clock. Inhale. Exhale out. Let's do one more each. Good. Come back to more of a neutral position where you're not tucking or tipping. Now, 9 o'clock to 3 o'clock feels a little different, and essentially it's the same kind of rocking movement. It's just now you're going to go side to side. So if our right hip is 3 o'clock, we are going to tip our hips to the right. So it kind of feels like you're putting more weight through that right side, and that left side's kind of gently lifting. And now tip to the left, which is 9 o'clock. Tipping to the right, 3 o'clock. And tipping to the left, 9 o'clock. Keep going back and forth. The other image you could use here, if it's a little confusing, is like your hips are a scale. And you're putting more weight onto the scale towards the left side, so it's dropping down. And then you're taking that weight off, placing it on the right side, and now the right side's dropping below the left. Few more like that. And then gently come back to your centered position. From here, let's give the pelvic area, lower abs a little break, and we're gonna go more to our upper abdominals with a crunch. So I want you to bring your hands behind your head, interlacing your fingers, and slightly narrow your elbows. Our feet are flat, and we're taking an inhale and an exhale initially to simply pull your rib cage down towards your spine and flatten your back before we even crunch. Now, from here, inhale through your nose. Take a full exhale as you lift, dropping your sternum and ribs down and back, and using your hands to help lift your head. Inhale as you lower, keeping the back flat. Exhale to crunch. Inhale back. Exhale, crunch. Inhale back, stays flat. Now get all that air out of your chest cavity so it's easier to lift. Exhale. And lift. 2 more. Last one. And lower down. Release those elbows for a second and just take a few breaths here. Hopefully what you notice there by keeping the back flat when you inhaled is your abdominals never fully relaxed. They were kind of on the whole time if you were able to keep that back down. Now we're going to go into obliques, so basically rotating. And what I want you to think about here is that you're not bringing your elbow to your knee and overly crunching through your neck. You're more rotating your rib cage towards your hip. So we're going to take an inhale, exhale to set the abdominals, pushing the back down. One more breath in through the nose. Now as you exhale, lift and rotate, rib to opposite hip. Inhale as you lower, keeping the back flat. Exhale, opposite direction. Inhale to lower. Exhale, lift, 3. And down. And lift, 4. Keep getting that full exhale as you come up, even if that means you're going slower than I am, which is always fine with me. I would rather you go slower than quicker. One more. And lower. Bring those arms behind you, stretch your legs out in front of you. Getting a nice stretch through those abdominals. And now we're going to go to what we call tabletop. So hands are going to come at your sides. You're going to bend your knees to start with to again relax that low back. Take a breath in through your nose. And now exhale as you pull your rib cage and abdominals back towards your spine. From here, keeping your back flat, you're going to lift up one leg at a time into about a 90-degree position at your hips and knees. Squeeze your knees together if that range of motion is available to you, and see if you can hold and breathe here. Inhale. Now full exhale, really trying to guide the front of your rib cage back towards your spine, and notice how that really deepens that ab engagement. Exhale. One more breath. And then draw your knees into your chest. Gently rock side to side. Giving the abs a little break. And we are going to add on. Now, if that felt challenging for you, stay with that movement. Really just try to get the deep breath in as you hold, so you can work on that really deep abdominal engagement. If that felt okay for you and you didn't feel any grabbing in the front of your hips or your low back, go ahead and add on with me. So we're going to come back to tabletop. Abdominals and ribcage are pulling back to my spine. I'm gently pressing my hands into the floor. From here, inhale as you lower one toe down towards the mat, moving from the hip joint. Exhale as you bring that leg up. And now alternate. Inhale, lower the opposite foot. Exhale as it lifts. Inhale, lower. Exhale, up. And lower. Exhale, lift. Lower. Exhale, guide those ribs back one more time. And knees into the chest. Again, you can gently rock side to side here. Give your abdominals a little break. From here, we are going to go into what we call a 100s prep. So our feet are going to come down, arms are going to come up to the ceiling. We're going to crunch as we reach our arms down towards our feet. Take an inhale through your nose. Now as you fully exhale, reach the arms forward out and down towards the hips. Sternum and ribs pull back to your spine. Chin comes towards the chest, but notice I still have a space here. Inhale to lower down, arms reach to the ceiling, back stays flat. Exhale, right back up, reaching the arms down and out. Inhale to lower. Exhale. Inhale. Through the nose, tongue at the roof of the mouth. Exhale, lift. Inhale, lower. Exhale. Inhale, lower. Now, keep going with that if that felt challenging enough. If you want to add a little challenge, let's come into tabletop, one leg at a time. We've got 5 more. Same crunch, knees and hips stay at 90 degrees. Exhale to lift. Arms reach down towards your feet. Inhale to lower. Exhale 2. Inhale, lower. Now as you lift, take a peek at your abs here. Make sure they're pulling back rather than popping up. If they're popping up, you either need to lower your feet down or you need to fully exhale. One more. Inhale down, and again, knees to the chest. Woo. Rock side to side. I don't care how advanced you are in your Pilates practice, that is always challenging if you get that full breath and that really deep ab engagement. From here, let's give the abs a break before we go to roll-ups. And we're going to come into some bridging. Hands at your sides, feet are hip-width apart, and we want ankles, knees, and hips in as much of a straight line as you can. Now before we move here, I want you to feel your heels and your big toes down into your mat. Don't let that connection leave. We want our body to sense the ground so it understands we have stability. Take an inhale through your nose. As you exhale, you're going to pelvic tuck. So think of that 6 o'clock position that we talked about a bit ago. Keep tucking your tailbone under, so pubic bone towards the belly button as you peel your back off the mat, 1 vertebrae at a time. Inhale at the top of your movement. Now exhale, slowly roll down, placing 1 vertebrae at a time back onto your mat. Low back, and then tailbone is the final part to hit. And again, exhale, tuck your tailbone under, slowly lift those hips, 1 vertebrae at a time. Inhale at the top. Exhale to round it down. Inhale, resting. Exhale, tuck. Inhaling at the top. Make sure those ribs aren't above your chest. Exhale it down. 1 more time. Exhale. And relax. Very good, you guys. Now into roll-ups. We're going to start with a modified version here, and then I can show you the full thing as we go along. So to begin with, we're going to start with our knees bent and our arms back overhead. The goal of this exercise is to get your exhale happening at the same time as you're articulating yourself off of the mat. So we're going to inhale our arms straight up. Now exhale as you start to peel your back off the mat, reach your legs forward. Notice I'm staying rounded, coming up and over my legs. Take an inhale in this position. Now exhale, slowly start to roll down. 1 vertebrae at a time. Reaching out through your feet as you roll down and lengthen it all the way back out. Good. Now, if that was challenging for you, and you had a hard time getting up, try this version with me. Otherwise, do what we did last time. Hands can come behind your thighs. And what you're going to do is you're going to help pull yourself up. So take an inhale. Exhale, tuck your chin towards your chest, push your legs into your hands, reach those legs forward, out, and down, then let go, coming into a forward fold. Inhale in the stretch. Exhale as you start to round down, 1 vertebrae at a time. You also have the option to simply sit up between each repetition and just practice the roll down part. All right, I'm gonna go back to my knees bent. You can keep your hands behind your thighs if that was easier for you. Inhale the arms up. Exhale, chin towards your chest, start to roll it up, reach your legs forward and out, keeping the connection on the mat, Coming into your stretch. Inhale. Exhale, roll it back. I'm tucking my tailbone under. I'm connecting my rib cage back towards my spine. Arms up overhead. We've got 2 more. Bend both knees. Inhale your arms up. Exhale, chin towards your chest as you start to extend your legs forward. That kind of helps to pull you upright. Inhale. Exhale, round it back. And one more time, knees bent. Inhale. Exhale, chin to chest. Start to reach the legs forward to help pull you upright, but you're staying round. Inhale here. Exhale, round all the way back. 1 vertebrae at a time. Whew, very good. Bring your knees into your chest. Use your knees to pull yourself upright. And we're going to get into what's called rolling like a ball. From here, you're going to stay seated. And you're going to find those 2 sits bones right under your hips. As you pull yourself into a ball shape, hands stay on your shins, elbows come wide, and we round our back and gaze at our belly button. Now, keep your rounded shape and that connection through your hands and your shins as you lift your feet just off the surface enough where you're balancing right behind your tailbone. Our goal is to keep this shape as we rock back and forth. So, we hold that position, shins pushing into the hands, hands pushing into the shins. Inhale as you rock back. Now exhale to come up and balance on those hips. Inhale back. Exhale, up and hold. Inhale back. Exhale. Inhale. Make sure you're not throwing your head back. Use your inhale to feel like your ribs are pulling you down. Whoop. One more time. Now we're going to reverse the breath so you can kind of see how breathing affects movement. I want you to exhale to round back, inhale to come up. So take an inhale, exhale back, inhale up, exhale back, inhale, hold. Two more times. Keep your ball shape, stay around, last one. And relax those feet down. Good job, you guys. Let's go ahead, change positions and gears totally, and come onto your stomach. All right. From here, our legs are lengthened behind us. You don't have to have your legs squeezing, especially if you feel a lot of pressure in your low back when you do that, but you don't want the legs way far out, at least hip width apart. Now, bring your hands in front of you, and I want your pinky fingers facing down, thumbs are facing up. We're taking our pubic bone and we're pushing it down into your mat. That's serving as an anchor point, not only to give your body a sense of stability, but also to keep that low back from overworking and isolating too much here. Now, last piece of this puzzle, I want you to take your abdominals and your rib cage and feel like you're trying to lift them up towards your spine. From here, we're going to inhale as you pull your shoulder blades down and away from your ears. You lift your chest up and out, gazing at the front of your mat into what we call mini swan. And now exhale as you slowly lower down. Again, inhale, shoulder blades pulled down, sternum and chest reach forward and out. And exhale as you lower, sliding the hands forward. Notice as I'm lifting here, I'm keeping my elbows straight. I'm not bending them to try to give myself more leverage. I'm really using those muscles in the bottom of my armpits to help with this movement. 2 more times. Inhaling as you lift, pushing the pubic bone down. Exhale to release. Last time. Abs and we're lifting, and then exhale to lower down. Bring your hands together and under your head. And just take a few breaths here, breathing into your belly. Exhaling everything out. Inhale. Exhale out. From here, we're extending the arms back out. Again, thumbs are up. Pubic bone is pushing down. And then I want you to gently and barely lift your head off of the mat. Feel like you're reaching out through the top of your head. Now from here, we're going to lift opposite arm and leg up and then lower them down. I'm still keeping my head lifted and my back is lengthening. Lift the other opposite arm and leg and lower down. And we're gonna go back and forth. You can inhale or exhale to lift those limbs. It's whatever feels most natural to your body. Don't forget about pushing that pubic bone down and lifting your abdominals and your ribs. 1 more each. And slowly relax all the way down. Very good, you guys. Last movement we're gonna do here. Bring your hands to your sides, palms facing down, reaching towards your feet. We're gonna come up with what we call rocket. Now, for some people, it would be really easy to lift up super high, and you would honestly probably end up using way more of your low back. I wanna try to isolate that more upper mid-back area. So, as you inhale and lift here, I want you to think of reaching your fingertips towards your feet, pulling your shoulder blades down and away from your ears, and feel as if you're rolling a ball out from under your chest, and then slowly lower down. And again, inhale, reach those arms back, fingertips, rolling that ball out from your chest, and slowly lower down. Few more. Inhale, reaching up and out. Exhale to lower. Last one. Inhale. Exhale to lower. Good. Push yourself up. Go ahead and sit back into a child's pose. Again, remember, don't let the knees come too far out to the side. And take a few deep belly breaths here. Letting your abs go. And just feeling that gentle expansion through the sides and back of your rib cage. Good. And from here, we're going to come onto your side. I will lay on my left first. You don't have to do that. We're going to place our bottom hand under our head. Bottom leg is at about 90-degree positioning, like you're sitting in a chair. And that top leg is straight out from your body. Now, in this position, it's really easy to be kind of just passively laying and sinking into your bottom side. So I want you to think about a few things here. 1, take that bottom rib cage and feel like you're gently lifting it up. So you're creating this little space under your side, which is helping to put you in more of a neutral spine position. Secondly, think of the front of your rib cage. Gently pull those guys back towards your spine. It's easy to overarch and extend here, and you'll lose that abdominal stability. And lastly, make sure your hips feel stacked. That top hip should be directly on top of the bottom, not rolling back behind you. Keeping all of those things in mind, reach out through that top heel, and now exhale to lift that leg straight up, just a little above the hip level. Inhale to lower it down without it resting. Exhale, lift 2. And 3. Feel like you're constantly trying to press your heel into the wall opposite of you. 6, 7, 8, 9, and 10. Bring that leg level with your hip, and now small circles towards the back wall. 8, 7, 6, 5, 4, 3, 2, 1. Check with that side body. Is it still lifted? Are your ribs still back? And reverse. 8. Still get into that hip extension here. 5, 4, 3, 2, 1, and lower that leg down. Woo! Give that glute a little love tap. Hopefully you're feeling it on the side / back part of your hip. If you started to feel it in the front of your hip or down into your quad, all that means is that that leg was either coming too far forward or going too high. Probably a combination of both. And from here, let's switch sides. Again, arm is resting on the head, bottom leg is bent, top leg is out. We're lifting that bottom rib cage and pulling both ribs back to the spine, checking that our hips are stacked, reaching out through that top heel, exhaling that leg up, and inhale to lower. Exhale, 2. And as you're doing this here, it shouldn't feel like your hip is going kind of wonky back and forth. It should be nice and stable. And we've got 4, 3, 2, and 1. Lowering to hip level, circles to the back. 8, 7, 6, 5, 4, 3, 2, and reverse. And 8. Get that hip extension. 6, 5, 4, breathing, 2, and 1. Lower that leg down again. Give it a little hip tap. Tell your body good job for doing that hard work, because that isolation can be very challenging. And now, as we come towards the end of our class, we're going to come back onto our hands and knees. So from here, our wrists are under our shoulders, knees are under our hips. Take an inhale through your nose. Now as you exhale, pull those abdominals and ribs up towards your spine, just like we talked about at the beginning. Maintaining that engagement and trying to keep your weight equal, not only from left to right, but from front to back. See if you can lift opposite arm, opposite leg up and out. Really reaching out through your fingertips and toes. Breathing as you hold. And then gently place that combination down. Hopefully you didn't feel your weight shift too severely as you were holding or as you were coming out of the position. Again, we lift the abdominals and ribs. We lift that other arm and leg combination. And we hold. Again, lengthening out. Don't be so scared that you kind of pull in. Rely on those abdominals. They've got you. And then gently place that down. Let's do one more each side. So we lift. Come back to the first combination. Breathe. Place them down. One more time. Try not to drastically shift your weight. Place that down. Sit back into a child's pose one more time. You can even gently lift your hips and round your back here. Sometimes this little more active position feels really good. And now we're going to come on to our hands and knees to end with a plank. If you have wrist problems or your wrists are just tired at this point, you can always go onto your elbows. If you tend to hold planks and you notice your low back starts to bother you, then I would recommend staying more on your wrist. Take an inhale. As you exhale, lift your abdominals and rib cage up. Make sure those shoulder blades are pulling away from your ears. Step back 1 foot at a time, squeezing those legs together, and we're gonna hold and breathe. Try to lengthen that exhale as best as you can, so as that breath comes out, your abdominals pull up. Give me 1 more full breath. And knees down. Slowly come off of your wrist. You can kind of gently roll them out. And go the other way. And to end with, you can sit in whatever position feels comfortable. Just bring your hands on your rib cage. Close your eyes. Relax your shoulders. Take a deep breath in. Full breath out. And feel those ribs expanding. Your body relaxing. 1 more breath. And you are done. Nice job with completing the class. I really hope you enjoyed it, and I hope to see you back.